take BSI precautions. I'm going to determine the scene is safe. I determine I have one patient. I don't have additional patients. I don't need additional resources, and I will take and/or direct C-spine precautions. Hi, my name's Thomas. I'm an EMR. What's wrong with you? What's your name?
My name's Keelan.
Okay, how old are you?
21.
You know where you are? Where are you?
St. Anna's Junior College.
And how many quarters are in a dollar?
4.
Okay, so I've determined her APU scale is 4 out of 4. I determine lung sounds. Lung sounds seem clear. She seems to be talking correctly. If her lung sounds were inappropriate, I would articulate words bilaterally on left and right. Also take. There you go. I will determine if she had problems breathing, I would put her on oxygen, and I don't see she needs any oxygen. I will check for presence of a pulse. She has a pulse. Determine the skin signs. She seems to be pink, somewhat pink, warm and dry. I will look for any life threats. She doesn't seem to be bleeding. And what's her, so what happened to you?
I fell and because I twisted my ankle.
Okay, so it's twisted ankle. Okay, twisted ankle. All right, so there are no life threats. I determined if she's bleeding, bleeding profusely, I would fix that. I would treat her for shock. I'd cover her with a blanket. I'd elevate her legs. And I would determine if this is a high or low priority. Right now, this is low priority because of her ankle. If this was a high priority, I would attack her kill zones. So I'm going to check her head, I'm going to check her neck, I'm going to check her face. Go ahead and smile for me. Okay, I'm going to look at her eyes, I'm going to check her neck. Go ahead and breathe in. Okay, I'm going to check her chest, I'm going to check her pelvis, I'm going to check her abdomen, I'm going to check her legs, I'm going to check her back, see if there's any bleeding, see if anything's abnormal. Everything seems to be fine. So now I'm going to check, and now I'm going to treat her ankle. Okay. Depending on what it was, I don't see a break. I'd probably wrap it, put a little bit of ice on it. Okay. Now I'm going to, vital signs. Here you go.
Come on, go.
I'm going. This time, go ahead. Oh, I got plenty.
It's not a moving time.
Oh, it's not moving. Oh. So pulse is 60. 60 beats per minute.
Strong and regular.
Strong and regular.
Okay, good.
And we take a blood pressure. There can be a little bit of a tension on your arm. Let's see what this is. Oh, that's my time? Okay.
Somewhere between 6 minutes and 59 seconds and 7 minutes.
What's your usual blood pressure?
110 average.
I think that's right.
I got 100 over 70. I should check your respiration. Okay, so I got 16. 70, good, strong, regular, or clear, not shallow, No, it's not labored, not shallow, good tidal volume. So now I'm going to check her sample, signs and symptoms. Looks like she possibly has a bruised ankle. Do you have any allergies?
I do not.
Are you taking any medications?
I'm not.
No meds. Has this happened to you before?
Yes.
How long ago?
2 months.
Okay, break or sprain?
Spray.
Okay, so you had previous spraying. And what'd you last eat? And what was it? Or what time?
A little granola bar at like 9.
At 9, okay. And what were you doing that led up to this?
Just being silly, and I can't walk very well, so I just my ankle.
Okay. All right, so now I'm going to check for signs of trauma, which is DCAT BTLS, which is deformities, contusions, abrasions, punctures, bruising, tenderness, laceration, swelling, and BP doc, which is bruising, penetration. I think it's also deformities, occlusions, and I'm miscracking it someplace. It's supposed to be in there. Oh, that's part of the C. All right, so I'm going to check the head for signs of trauma. I'm going to check the ears for signs of trauma, any draining. I'm going to check the nose for signs of trauma, any flaring. I'm going to check the eyes for signs of the trauma. Pink pearl, which is pink equal reactivity to light. Okay, I'm going to check for pink moist conjunctiva. I'm going to check her mouth. Please open your mouth. Okay, I'm going to check for any broken teeth, any foreign objects. Pink moist. I'm going to pull this down a little bit. Pink moist mucosa. Go ahead and smile. Okay, I'm checking her face for symmetry. I'm checking her neck for signs of trauma. All this is signs of trauma. For jugular vein distension, tracheal deviation. Then I'm going to check her chest for signs of trauma. Go ahead and breathe in and breathe out. Okay, breathe in, breathe out. And check for any flailing, emphysema. Something emphysema. Subcutaneous emphysema. I check her abdomen. Please let me know if you feel any pain. I'm going to check her quadrants. Okay. Okay. So do you feel anything? No. Okay. I'm going to check her pelvis. Check her pelvis for any pain, any incontinence. There we go. I'm going to check her legs for crepitus. Okay. Yeah. Let me know if you feel anything. Okay. That's her ankle, so I don't want to touch that. I'm going to check her. Also check her feet for, or check her distal pulse. I'm going to check her distal pulse. Tell me what toes I'm touching.
My big toe.
Okay, push up, push down. Okay, I'm going to check her arms. Okay, for any crepitus. You feel anything?
Nope.
Okay, I'm going to check CSM bilaterally. Tell me what fingers I'm touching.
My pinky.
Go ahead and squeeze. Okay. I'm going to check her CSM. Okay, seems fine. I'm going to check her back. Look for any abnormalities, any bleeding, any liquids. Done that. All seems fine. What?
Liquids, aka swelling.
Swelling. So now I'm going to reassess her ABCs. What's your name?
Kaylin,
How old are you?
21.
You know where you are? Where are you?
St. Arthur Junior College.
And how many quarters in a dollar?
4.
I'd put another set of vitals. Where am I?
Real time.
Yeah.
Oh, so time. So now I do a handoff. To the doctor. This is Kaylin. She's 21. Looks like she might have twisted her ankle. I put some ice. Oh, I would also assess if my actions were appropriate. If anything changed. Any swelling go down, or did she have anything else that I might have missed on the secondary? Which is Kaylin, 21, twisted ankle. Her pulse is 60, good, strong, and regular. Clear respirations at 16. Her blood pressure is 110 over 70, and I think I said I put a nice pack and I wrapped it. Is there anything I missed?
Talk about your signs of trauma again, and what you did versus what they can do.
Signs of trauma.
So you were using DCAT BTLS?
Right, and BP.
Right, and you did it per part almost?
Yeah, so every time I checked a part, it was a sign of trauma. So I'm looking for, on her head, you're going to look for DCAT BTLS, which is deformities, contusions, abrasions, punctures, penetrations, bruising, tenderness, laceration, swelling. So that can all happen in the head. It can happen on almost any body part.
Okay, stop for a second.
Yep.
So you guys are just going to say in each body part, I'm checking for signs of trauma, and you're going to kind of move on and say the other pertinent things. So like when you get to the abdomen, You could say, I'm checking for signs of trauma, I'm looking for abdominal distension, some tenderness, you know, the other things that make sense for that area. When you're in the chest and you're looking for subcutaneous emphysema, or you know, that makes sense in that area, but it might not make sense in the foot, right? So, but you can start by signs of trauma every time and then go to the things that are pertinent. Then when it's all done, after your handoff, they're going to say, list the signs of trauma. Because you said, I'm going to look for the signs of trauma. Okay, great, buddy. You're so smart. Give me your signs of trauma that you're looking for. That's when you get to list them all. If you want to use BP Doc and decap VTLS, that will cover enough to make you pass, right? But if you just remember the things on your list, that's fine too. Okay? That should help, make you feel better.